Did you know that babies can get UTIs or urinary tract infections? I'm Dr. Tracy Tyson. I'm a board certified general pediatrician, and they absolutely can. It's a low risk. It's anywhere from 1 to 7% in febrile infants or babies that have a fever, especially under 3 years of age. 1 year of age is the big cutoff. But this is really serious because even though that's a low percentage, if your child is one of those 3 out of 100, that's still a high risk factor. Urinary tract infections are usually what we're talking about in this age group is bacterial UTIs. They can lead to kidney damage, bacteria in the bloodstream, and really serious complications. So we want to catch them early, treat them early, and make sure that we protect those kidneys. So who might be at risk for that? There are going to be female babies, under a year of age, especially uncircumcised males, strong family history. White race is going to be the most common risk factors. So when would we test your child for a UTI? What would it look like? We test your child for a UTI when they have a high fever over 101.5 for over 24 hours without a source in a child over 3 months of age to 12 months. Under 3 months, whole different ball game. We'll talk about that in a different video. But for 3 to 12 months, it's usually going to be at that point. If we don't have any other source, there's that 3 to 7% risk that the baby has a UTI. So we're going to want to check that urine just to make sure. If the child is over 12 months, we might give them a little leeway. A lot of times I pick the 3-day mark. If the fever sat for 3 days, over 101.5, sometimes over 102 depending on the kid. If they've never had a UTI before, they look really well, but there's no source, I'll give them a little bit longer before I want to check the urine. So how do we check the urine? We check the urine in one of 3 ways. The first way is you can do a clean catch specimen if the baby is able to pee into a cup. Now that's typically going to be a potty trained child, but every once in a while we are able to do that in the room. And I won't describe to you how we do it, but basically babies sometimes just spontaneously pee and we're sometimes able to catch it. Another way would be a bag urine specimen. And while this is not a way to get a culture of the urine to determine what bacteria, if you have a low suspicion, the family's not super interested in any other kind of testing at that point, you can offer a bag specimen, which is where we put a bag over the urethra where the baby can pee into it. We test it in office. If it looks suspicious, we'd have to go back and say, hey, this looks suspicious for a UTI. Now I need to do something called a urinary catheter, which is where we do a little straight catheter with no bulb on the end, insert it into the baby's bladder through the urethra, get some urine, pull it right back out. It is sterile, meaning you're not going to get any bacteria from the skin, and you're going to be guaranteed that if there's bacteria, you're going to be able to catch it. So this is our gold standard. The third way is a suprapubic aspiration. That's going to mostly be in really sick babies in the hospital where you can't get a catheter for some reason. You can go through the skin on the stomach and actually go straight into the bladder. So those are the ways that we test. I know that seems invasive, and that's where I usually lose parents, and they go, whoa, wait, why are we doing this? We're doing this because they can get really bad really quickly, and babies do not show signs of UTIs except for fever. Sometimes they'll have vomiting, but that's about it. So once we test, if we have a high suspicion for UTI based on the urinalysis in office, we'll start the baby on antibiotics. If they're under 6 months of age, we might do a blood culture. Just depends on how sick the kid looks. Start them on antibiotics, have a culture growing, make more definitive answers at that point in time. So I hope this helps a little bit. So remembering if your baby has a high fever, especially under that 1 year of age, there's a high likelihood that we're going to want to check their urine. It's a gold standard. It really does need to be done. Talk to your doctor or primary care provider about what are the best ways to test. Ask them their questions, but this is pretty standard and it's to keep your baby safe. Take care.